Good evening, I'm Pinky Webb. Tonight we ask the questions, we tackle the issues, we clarify matters, and we get on point. Criticisms plagued the Philippine Health Insurance Corporation after it was discovered it had hundreds of billions of pesos in untapped funds. Some accuse PhilHealth of fiscal mismanagement for failing to pay its obligations on time and provide more benefits to its members despite raking in huge profits. Even government found PhilHealth's financial standing unacceptable, denying it of state subsidy this year and forcing it to use its idle funds. Some are calling for heads to roll. Even the Secretary of Health believes a total revamp is necessary. Let's get on point with PhilHealth's spokesperson and Senior Vice President for Health Finance Policy Sector, Dr. Israel Pargas, who joins us on the line. Dr. Pargas, good evening to you and welcome to the show.
Yes, good evening, Pinky, and of course, good evening to everyone. Happy New Year.
Happy New Year. Thank you for your time. So it's official, there will be no subsidy for PhilHealth for 2025. Will there be any adjustments that are necessary to make without this 70 billion that PhilHealth was expecting?
Well, again, as stated by our President, Emmanuel Ledesma, and of course, also echoed by the President PBBM, we have enough funds to sustain our operations and continue paying our benefits for 2025. And in fact, we are actually improving and aggressively expanding our benefits. Before the year ended, we came out with other 6 new packages that will actually be implemented this year for 2025 also.
Okay, since you talked about these packages or this, what do you call it, Dr. Pargas? Are they benefits or case rates? What exactly are they called?
Well, they are actually benefits, and one of the benefits actually that we have improved or expanded is our case rate packages. It is actually the way we pay our benefits to our members. For example, the pneumonia package, for example, is the high-risk pneumonia. We increased it from previous of 32,000 case rates to right now we are paying it to around 90,000 pesos. So before the year ended, if you would remember, Pinky, in February of 2024, we actually increased 30% to our case rates. This is around 9,000 case rates. And before the year ended, we had another 50% increase for all these around 9,000 case rate packages.
It's good that you brought that up, Dr. Pargas, because while you were saying that there was an increase, rightly so, in February 2024 of 30%, and again before the year ended of 50%, there was no case rate increase for 11 years. It was in 2013, or rather since 2013 to 2024. 2024 of February was the first time that PhilHealth increased its case rates by 30%, which basically many say is just really inflationary.
Yes, actually the 2024 30% increase is for the medical inflation, and for the 50% increase before the year ended, it's really to increase the support value or decrease the out-of-pocket of our members. But we actually aggressively started increasing individual case rates in 2023 when we started with the pneumonia, with the stroke, which we increased from 26,000 to 76,000. And of course, coming up with new benefits like mental health packages in 2023, or even our primary care benefit, which is what we call now the Konsulta, in 2022. But for the almost across the board case rates, 9,000, yes, we did it in February and, of course, in December of 2024.
Why did it take 13 years, or let's just say, let's put it at 11 or 12 years, Dr. Pargas, for PhilHealth to increase its case rate packages?
Well, for one, we had priorities. One is, of course, the primary care, which we came out also. And then there was this pandemic wherein we actually came out with 6 new packages. And, of course, coming out with other packages that would actually cover some of the diseases that were not previously covered by PhilHealth. And then in 2022, we started out with coming with a process on how to actually increase the case rates, and we started it in 2023.
Right, but it still took 10 to 11 years before case rates were increased. So, and
Yes.
unfortunately,
Yes.
it doesn't answer my question, Dr. Pargas. Bakit po nagtagal bago po itinaas itong mga case rate packages? Why did it take 10, 11, or 12 years, Dr.
Well, yes.
Pargas?
Well, actually, admittedly, we were not able to increase our case rates in 2013 to 2023 for that matter because of some priorities. But of course, we cannot at the end uh, make amends with this. And of course, that's why in 2023 we started aggressively increasing our
Okay.
benefits.
But would you say that was a big mistake of
Well,
PhilHealth?
Well, it's not actually a mistake, but really we just had some priorities then.
Okay, but wouldn't the priorities be to help the members lessen their out-of-pocket payments in hospitals? Wouldn't that be the
Yes.
priority of PhilHealth?
Yes, that is actually also a priority, but of course we have to come out with other new benefits for those diseases that we have not been covering for the longest time, and so we actually prioritize them.
When we look at what PhilHealth pays, there was a study published in the Inquirer that, in fact, Secretary Ted Herbosa had mentioned yesterday. Lumalabas po, and you have the opportunity to correct me, or the Secretary of Health for that matter. Lumalabas daw po na, for the most part, ang binabayaran lang po ng PhilHealth sa ospital ay 14%. Dito po sa, I think what we're talking about is more or less on an average po. Especially with the working class. Would that be correct?
14% or
1-4.
40%?
1-4, sir.
Well, for one, I haven't read this particular article, but I'm not so sure if that is the support value or that is the percent of our coverage for the total health expenditure for the nation, but I'm not so sure if the subject matter is really on the support value. But at any rate, yes, we also agree that we actually are providing a smaller support value. That's why we are trying to increase and expand all our benefits now, because the real objective is to make sure that we can provide more financial protection and increase the support value for our members.
And under the Universal Healthcare Law, this year, 2025, how much should PhilHealth be paying in terms of percentage to the cost of hospitalization?
Well, we are not actually paying according to percent for the hospitalization because, again, what we are paying is through the case rate or case packages. But according to the National Health Financing Objectives, we want to increase our support value to around 40%, and in 2030 around 30%. Out-of-pocket expense only for the member. So meaning that's increased to 60% support value or up to as high as 70%.
Yeah. Basically, ang ibig po sabihin nun, Dr. Pargas, is that pag ako po ay na ospital, the goal is that PhilHealth will cover 60% of what the hospital will bill me.
Yes,
Is that correct?
basically, yes. Yes, but of course, Pinky, we would also want to remind that under the Universal Healthcare Law, when a member opts to be admitted in a ward or basic accommodation of a government or even private facility, there should be no co-payment, and the PhilHealth benefit package is enough. So that would be around 100% when we are admitted or we opt to be admitted in a basic or ward accommodation.
This where the no billing talk comes
Yes.
in. Opo.
Yes.
Okay,
Yes.
para po malinaw, Dr. Pargas, this only happens in government hospitals, hindi ho ba?
No, Pinky. Dun po sa UHC law, it's a no co-payment or no billing for those who would be admitted in basic or ward accommodation in public and private hospitals. However, in the public hospitals, it is around 90% of the beds, and for the private, it is around 10% of the beds should be basic or ward.
What does that mean, 10% of the beds should be basic or ward in private hospitals? Could you further explain that, please?
So, for example, the hospital capacity has 50 beds, then 10% of that
I see.
should be a charity or basic or work
Got it.
accommodation.
So 10% of every private hospital.
Yes, correct.
What happens kung napuno na po yun, Dr. Pargas?
Well, according to our policy right now, especially on the no balance billing, kapag puno na po yung ating mga ward or basic accommodation, then yung pasyente po who still opts to be admitted in a basic or ward accommodation should be admitted into a next higher
Category.
room accommodation. But ang sinasabi rin dun, Pinky, is kapag meron ng bakante sa ward and basic accommodation, siya ay dapat ma-transfer na to that.
Ibabalik
in order
doon.
to avail of the basic, yes,
Yeah.
of the no balance billing. But when she or he opts to stay in the private, then out of the no balance billing policy na po siya.
Siya na magbabayad nun. Kasi kumbaga,
kung meron
choice
po-
na po yun ng pasyente.
Yes, opo. Kung meron pa pong excess, meron siya na po yung mag-handle ng co-payment for that.
Okay, we'll have more of our discussion with Dr. Israel Pargas. After the break, please stay tuned. This is On Point.
From the story of ancient beads traded into the Philippines to textiles adorned with sequins, from animist motifs to Christian symbols, all proudly proclaiming our sense of beauty to an admiring world. There is really much to be preserved. Dayaw, our knowledge, our pride.
Magandang gabi, ako si Corina Sanchez Rojas.
Magandang gabi, ako po si Pinky Webb.
Simulan na natin ang agenda.
Nasa radyo na, mapapanood, mapapakinggan.
94.7 FM.
Nahaharap ngayon ang Estados Unidos sa isa na namang 4 na taong Trump presidency.
Death squad rin yan.
Binawi niya yung sinabi niya.
Ing masalimuot ang buwan ng Oktubre para sa ilang milyonaryo. Sa bawat issue may anggulo at ang balita may agenda.
Welcome back. You're still watching On Point, still with us, PhilHealth's spokesperson, Dr. Israel Pargas. Dr. Pargas, mabilisan lang po ito. Doon po sa sinasabing madaming pera, o yung meron pong investable funds, meron pong reserve funds na 200 plus 80 billion, at meron pong surplus funds na 150 billion pesos. I guess it's the basic question, and I hope you could shed light on this, is bakit daw hindi kasi nagamit itong perang to kung napakalaki daw naman po ng pera ng PhilHealth? Please respond to that.
Yes. Well, unang-una, nasa batas din po na dapat tayo ay naglalagay ng tinatawag na reserve fund. At yun pong sa reserve fund na yan, ay yun po ay pera na hindi dapat natin ginagastos at ito ay gagastusin lamang kung magkakaroon ng mga tinatawag na emergencies or like pandemics or epidemics na mangyayari. And so, kaya po meron tayong tinatawag na reserve funds, no? Then with regard naman po to our surplus fund, and then yun nga lang po nagkataon na tayo po ay nagkaroon nito because probably dahil medyo naging babagal nga po tayo sa pag-expand ng ating benefits. But again, na ngayon naman po is we are actually aggressively increasing and expanding all our benefits.
At least there you admitted that medyo naging mabagal dun sa pag-expand ng benefits. Maybe talagang naging mabagal. Dr. Pargas, pag-usapan na po natin yung benefits. This 2025, so there's been an increase, sir, of 50%. Am I correct for 9,000?
Almost 9,000 case rates po because there are cases na hindi po namin isinama with the increase of 50% because they were increased separately. Katulad po nung nabanggit ko na pulmonya or yung severe dengue or even po yung ating for heart attack and all.
Okay.
Hiwalay po ang pag-increase sa kanila.
Okay, Dr. Pargas, I'm going to put that in. No? We have the graphics of this. There are exemptions to this 50% increase. in
Yeah.
case rates. I'm not sure if we can bring that up right now. I wanted to discuss this with you. But you were saying that they are basically excluded because meron, tama ho ba yung pagkarinig ko ito? Like for example, excluded from the 50% case rate adjustment, benefit packages that are being rationalized, acute stroke,
Yes.
this is what you're talking about, pneumonia, that's high risk.
Yeah.
Neonatal sepsis. Bakit po again, please explain bakit po sila excluded?
Because yan po ang una natin na plano with regard to the increase in case rates is we actually reviewed and we used the some criteria on which cases to prioritize. At yan po yung ating lumabas sa study using the criteria of which are actually the top burden of diseases in the Philippines and kung ano po yung maraming claims and kung ano yung mababa yung support value. So, basically, kung i-equate po natin, yan po yung mga top 10 mortality and morbidity cases. That's why nauna po yung pag-increase natin ng pneumonia, ng neonatal sepsis, bago po nangyari yung increase inflationary of 30% and the 50%.
What about dengue?
Yes, the dengue po is kasama. So especially the severe dengue na kung saan doon po mas malaki yung kinakailangan nating support value. That's why it was increased from 16,000 to 47,000.
Yeah.
That is actually around 300% increase.
But this is severe. You talked about severe dengue.
Yes po, the severe. And then the simple dengue or the dengue fever is part of the 30% or the 50% increase.
Because I asked about that in a hospital, in a private hospital, how much is PhilHealth going to cover for dengue? And I was told, but this was 3 months ago, it was 9,000 pesos.
For simple dengue or dengue fever, we cover actually 10,000 pesos previously before the 30% and the 50%. Now, with the 30 and 50%, it's 19,500. And of course, for the severe, it's 47,000.
Got it. Just maybe also an issue that needs to be discussed. Secretary Ted Herbosa was also talking about this yesterday when he was a guest here in the studio. He was basically saying that while we have the indigents, yung pong the poorest of the poor, nandun na po si no balance tama ho ba? No
Billing.
balance billing, no?
Yes.
Natutulungan po natin. As he mentioned, it's almost like a pool. We put all this money together, and the 10% supposed to be na nagkasakit, yun po ang nagagamitan nitong pool ng pera. But he mentioned something quite important, the working class. What kind of assistance or help can PhilHealth give to the working class? I'll give you an example, Dr. Pargas. For example, somebody who is working in the mall, who is a minimum wage earner or maybe a little higher, nagkasakit po siya at hindi po madala sa government hospital. Let's just say, sir, puno po doon. Malaki ho kasi yung kuha nun eh. Minsan kasi wala nang halos savings kahit yung
Yes.
sa working class. Are there measures by which PhilHealth is looking at to be able to somehow help this segment of society?
Yes po. Actually, admittedly right now, talagang kung sino yung mag-opt to be admitted in a private, in a basic or ward accommodation, sila yung merong no co-payment. But this is not only for the indigents, but even for the working class who would opt to be admitted in ward. However, tama ka rin na meron talagang mga pagkakataon na sa private facilities sila at magkakaroon ng co-payment. So what we are studying right now is to come up with kung dun po sa ating ward or basic accommodation, meron tayong no co-payment rule or no balance billing. Pagdating naman po doon sa mga private rooms, ang tinitingnan po natin at pinag-aaralin natin ngayon is to come up with a co-payment policy. With the co-payment policy po, ang pinagtitinitingnan natin is to come out with a fixed co-payment para kung halimbawa po ma-admit ka in a private room, hindi ka pwedeng singilin ng isang ospital or ng doktor exorbitantly, but rather magsiset po tayo ng fixed co-payment percentage. For example, ang ibabayad na lang po nila is dapat 30% of the bill. So ganun po, or 15%. But of course, it has to go through studies and negotiations with the facilities and the professionals.
30% lang ang babayaran ng pasyente?
Example lang po yun.
Oo,
Because,
yeah.
of course, we need to get the actual cost and, of course, the professional fees para po mai-set natin at may negotiate yung fixed co-payment.
Yeah. And I think it's also important, Dr. Pargas, that this is disseminated. I know this is in its initial stages, as you mentioned a while ago. This is just an example. But also that it attracts the doctors because kung bababaan naman yung pong bayad, kunwari i-mandate na maliit lang, minimum lang yung ibabayad doon sa doktor, eh baka po hindi din pumayag yung doktor. There has to be some balancing issue there.
Yes, tama ka naman dyan, Pinky. That's why part of our activity is to take or to do the costing analysis. That is actually to get the actual costs coming from the health services and, of course, coming from the professional fees.
Okay, I want to talk about Konsulta package. I only have 2 minutes left, though, Dr. Pargas. No, a lot of people have commented about this Konsulta package because I had discussed this briefly many months ago. And they went to the website and some of the comments were, page could not be found. Ano ho ba si Konsulta package? Because this is supposed to be 1,700 pesos na libre na screening, which would be important annually for anybody to be able to avail of this. Even Secretary Ted Herbosa wasn't too happy because he said that it's a little bit confusing. What is PhilHealth doing about this Konsulta package, which is, again, mandated under the Universal Healthcare Law?
Yes, the Konsulta is our initial program for a comprehensive outpatient benefit package. So this is a primary care package provided by Konsulta, accredited Konsulta providers. Currently, we have around 3,000 nationwide. Around 400 of those are private clinics. They are actually to provide free consultation, 15 diagnostics, including mammogram and ultrasound of the breast, and 21 free drugs to include maintenance drugs for diabetes, hypertension, and even for infections. But these are actually primary care benefits and are risk-based. So hindi po ito yung pupunta ka para humingi ng gamot or para po mag-request na gusto mong magpa-urinalysis, but rather, pupunta ka para ma-check up at kung kailangan mo pong mapa-urinalysis, i-order yan sa iyo ng doktor at kung ano ang kakailanganin mong gamot, ibibigay din po sa inyo ng libre. And again, this is being provided with private and public accredited Konsulta providers po natin. So tama ka rin na every person is allotted 1,700 for all those services. And bago po makuha ang serbisyo, you have to be registered in a Konsulta provider of choice. Para po yung for your own convenience, kung saan ka malapit, kung saan ka malapit nagtatrabaho, doon ka po makakapagpa-check up.
So kailangan po silang pumunta sa Konsulta providers. Yung bang kumbaga yung mga clinics or hospital that is accredited as Konsulta providers?
Yes po. Pero ang registration po can be done either online through our website or kayo po ay pupunta rin kung gusto po ninyo doon mismo sa ating mga Konsulta providers para po ma-check up na rin po kayo.
Are the Konsulta providers available in your website?
Yes po.
Okay. Because again, Dr. Pargas, let me repeat that there were comments saying that its page could not be found or hindi daw nila mahanap. Is there going to be a move or a plan by PhilHealth to actually really make this more digestible, understandable, and easier for those who want to avail of this Konsulta package? Because why not? Why not avail of this 1,700 peso annual Konsulta package?
Yes, actually, we are also thinking on how we can inform our members, particularly with regard to the available Konsulta providers, because so far it is limited through our website. But, and of course, the 3,000 will not answer to the 116 million Filipinos because everyone is actually provided with this benefit. And so we are continuously expanding and accrediting our facilities, especially the RHUs or even the private clinics. So patuloy po natin na ma-market yan para mas marami tayong maging providers and of course, making sure that the information is more available to our people.
Konsulta providers, 3,000 right now. What is the target number of Konsulta providers?
We are targeting more than 5,000 to cover for the 110 million Filipinos because may standard po kasi ang Department of Health that for every doctor, there should be around 20,000 patients na tinitignan.
The doctor-patient ratio.
Yes, doctor-patient ratio. So kaya po more than 5,000 ang kailangan natin because there are some consulta providers that there are more than 2 doctors.
Okay. I hope that PhilHealth is able to work on this as soon as possible because, again, as mentioned, this is something that many would possibly want to avail of. We've run out of time, but I'd like to thank you for your time, Dr. Pargas. Maraming salamat po.
Yes, thank you very much also, Ms. Pinky, for the opportunity.
I hope to speak to you again. Thank you.
Yes, yes.
And that's On Point. Join us again tomorrow, 7:30 p.m. here on BNC, the Billionario News Channel. I'm Pinky Webb. Thank you for watching.